Hello, everyone. You guys diagnosed it very well. It's a case of interception. And starting with the description with the saying of Headsprung that he had never seen a malnourished child with interception. And our thought to it is a malnourished child does not have sufficient immune system to mount an immune response to the antigens that will cause hypertrophy of Peyer's patches and then lead to development of interception. Okay. So starting with the description, interception is basically the telescoping of one segment of bowel into the another. It mostly occurs in age group of 3 months to 3 years, but in most of the cases it is idiopathic. But in some cases there is some lead point to the development of that interception. It is called secondary interception. Well, it can be divided into multiple types. Like it can be a permanent interception or a transient one. Anatomically, it can be ileocolic, ileoileal, ileocolic, appendicocolic, sicocolic, colocolic, or ileoileal type of interception. And this ileoileal type is very specifically seen in Heno-Schönlein purpura. As we discussed earlier, it can be primary interception, which is idiopathic, or it can be secondary. Secondary one is due to any pathological lead point, and the lead point is mostly Meckel's diverticulum, intestinal polyp, lipoma, intramural hematoma in HSP, intestinal lymphoma also. Well, what happens in interception is the child usually presents with intermittent colicky pain, along with multiple frequent vomiting and the features of intestinal obstruction, along with the palpable abdominal mass with the passage of blood and mucus mixed stool, which is very specifically known as red currant jelly stool. And it is very specific for interception. And if the child presents late and it is a neglected case, it usually presents with shock. The child will be drowsy with high grade fever and tachycardia. The diagnosis is usually clinical. We can get a high suspicion that this child of intestinal obstruction is having interception. And the adjuncts to the diagnosis are plain radiograph and ultrasonography. And the gold standard test, if someone asks you, it is USG. In the management, we can try medical management, hydrostatic or pneumatic decompression, or operative management by either laparoscopic or open technique. In the medical management in Heno-Schönlein purpura, we can try steroids, but most of the other cases we need to do a hydrostatic or pneumatic decompression. If that fails, or in late cases when the child itself presented with sepsis, the management is operative. Thank you. So share this pediatric emergency case with your friends and share your experience with us in comments below. Thank you.